Introduction. We are facing an enormous public health crisis. Antibiotic drug resistance has grown significantly in recent years and poses a huge threat to our progress in health. Our strides in health are largely due to the widespread use of antibiotics. Death and disability from diseases such as pneumonia and tuberculosis have greatly decreased, and antibiotics make complicated surgical operations possible. Now, resistance is growing and many drugs are no longer effective. Inappropriate prescriptions, stopping a drug early, counterfeit antibiotics, and poor hygiene contribute to the growth of resistance. Globalization has increased infection rates, and good new alternative antibiotics are limited. Why is antibiotic resistance a problem? Antibiotic resistance delays treatment, causes complications, and is costly. Patients who are resistant are up to 3 times more likely to die. Worldwide, approximately 700,000 people die every year from drug resistance. If drug resistance is not tackled, it is estimated that 300 million people will die prematurely over the next 35 years, and that the world's GDP will be 2 to 3.5% lower. The good news is that approximately 1/3 of infections are avoidable, and effective interventions exist to prevent resistance. How can we reduce antibiotic resistance? We all need to work together on rationalizing antibiotic prescription and utilization, preventing disease, identifying infections early, responding quickly, and promoting other alternatives. Good examples of efforts to reduce resistance. Plans exist and all G7 countries have a plan. However, only 1/4 of the world's countries have implemented a national policy, and less than 40% have implemented infection prevention and drug resistance control programs. PRIOAM, a promising example for improving the correct use of antibiotics, can be seen in the Virgen del Rocío Hospital in Seville, Spain, where an educational program on prescribing practice began in 2011. PRIOAM works as follows. The hospital has local guidelines for managing infections. Weekly, expert clinicians give counseling interviews on the correct use of antibiotics. Satisfaction with the interviews are assessed using anonymous questionnaires. The appropriateness of the prescriptions is evaluated throughout the year. Feedback on correct use is communicated regularly. In every department, the improvement in prescribing practices is included in annual objectives and is linked to economic incentives. Some results from PRIOAM. After more than 200 interviews the first year, inappropriate antibiotic prescriptions fell from 53% to 26%. Antibiotic consumption declined, reducing this expenditure by 42%. 352 satisfaction questionnaires were received, and 98% described the advice as positive. Conclusions. Action plans and concerted efforts to combat antibiotic resistance are positive. However, we need to act now by making this a priority, sharing effective examples, and implementing programs before it is too late.